Good morning, youth development advocates. Thank you for joining us for another session of Java with James. For those of you who don't know, my name is Victor Amabili, and I will be your moderator for today. If anyone has a question, feel free to raise your hand, or you can enter it into the chat box. As a reminder, we hold these sessions every third Thursday from 11:30 to 12:30. Be on the lookout for our newsletter next week. We have a variety of trainings coming up for both program staff and mentors. Also, if you're interested in getting connected to your local mentoring programs, let me know, because we're currently rolling out a new online platform called the Mentor Washington Subhub, and I would love to get you guys connected to as many of the providers as possible to help you collaborate with one another. And on that note, please welcome Mentor Washington's Executive Director, James Miles.
Thanks, Vic. Welcome, everyone. This should be an informative session, and we'll make sure we leave some time for questions at the end. A lot is going on, especially as it relates to young people, COVID, and the world. So I'm hoping this will be quite invigorating. We just did a welcome. We led our introduction and icebreaker with positive youth development role model in your life. We'll talk briefly about mental health, ways to increase attendance with some resources and some school support systems, and then get into some vaccine stuff. So to set the stage of where we are, sometimes it's helpful to take a 30,000-foot view while examining what's very local to us. And that's pretty Brofenbrenner. Brofenbrenner's ecological theory has a model of what's in the middle, which is our micro, which is our house, where we live, our people that we live with. Our meso, which is our community, our church, our schools, our youth centers, and then the macro, which is the world at large. This little device here, our phone, has kind of blurred those lines. So what was once very external, like what's happening in other parts of the world or what's happening in other parts of the country, are now happening at the palm of your hand, and you carry the information with you everywhere you go, which adds to a certain level of mental and emotional diffidence, dissonance, and sometimes assonance. So you see some of these statistics here. As we know, COVID-19 has had a disproportionately impact on Black and Latinx populations. 73% of all youth that have died from COVID, and this is before the Delta variant, were Black and Latinx. That number has actually increased. We just had 300 cases located in Pierce County since school started. I think that was yesterday, which is just blew my mind when I read that in the paper today. And CNN reported an increase in suicide attempts, especially around girls, from middle school to high school. Getting back to normal won't magically make things go away, right? We all know that. There's a projected 30% increase in the achievement gap between the richest and poorest families. For reading was 25%. And of course, now, as of 2019, most public schools are youth of color, majority of color. So the shifting dynamics, the number of teachers are still predominantly 85% white women, but now the youth of color are the majority population in schools. So having all that context, what does that mean? Experiencing an overwhelming trauma, right? There's no doubt that COVID, the economic impacts of COVID, some of the racial and social impacts of COVID have all led us to have either first or secondary or even tertiary trauma experiences. And if you're experiencing any of these things here listed, you're probably dealing with some trauma yourself. You may not recognize it, right? It's hard to recognize something that's happening internally, but this is really just to keep aware of you. Are you jumping into that fight, flight, or freeze mode? Do you feel an increase in anger? Are you spending more time watching TV, reading books, drinking, using, recreational drugs, taking walks? All of these things factor in. Am I muted? Oh, thank you, Vic. Yeah. Disheartening, dispirited. I sometimes look at my own children and I say, what's wrong? And they're like, nothing. I was like, you're dissociating from your life right now. And it sucks to be the child of, or the children of me, because I'm like, here, let's talk about your emotions right now as you're navigating middle school. But anyway, what's key is understanding our spheres of control, our locus of control, and that is what you can control, and that's right here. You can control, when you put clothes on in the morning, when you take a shower, when you go to sleep, what you eat for lunch. Those are things you can control. Going outside, wearing a mask. And then there's what you can influence, right? That's outside of your sphere of control. I can tell my kids to wear a mask when they go to school, but I can't really make them. I have no control over what they do once they leave the house. I can tell my employees and my staff and my board, hey, it's important to get a COVID vaccine, but I can't control if they do or they do not. There's mandates from the federal government, but you can protest that with your feet. And then there's what outside of your control and influence, right? The virus is a great example of that. We have no control over the virus. What we can do is control what we can do, and maybe our families. We can influence others through webinars, through trainings, through conversation, but it's outside of our control. So it's really helpful to understand that when you're dealing with any kind of issue, some things are outside of our control, and you have to let go and release, and then try to do what you can to influence others to move forward. The key principles of a trauma-informed practice are safety, trustworthiness, peer support, collaboration, mutuality, empowerment, and recognition of historical and ongoing systemic traumatization or systematic traumatization. If we're looking at our school system right now, much of this is missing. I was talking to a principal not too long ago, just about a couple weeks ago, and he said, I don't know what to do. We have to focus on testing immediately. I talked to my daughter last night. She says, Dad, my whole day is full of testing. And I said, what about the social emotional stuff? She's like, that was the first day of school. Now it's all about tests. So, and it's no fault of the teachers, right? Or the external, teaching artists or mentors or people working outside of the school system. This is the system that we've all inherited. And how do we try to make it more trauma-informed, multi-tiered, with some support systems? So how do we increase both physical and emotional safety? How do we create a more trustworthy and transparent environment? How do we support each other? Thinking of our most vulnerable populations, they really need just a caring adult in their life. Why we're all on this call, a caring adult in their life. How are you working with others in different sectors or in your own organization? And whose voice are you uplifting and whose voice is missing from that table? Especially when acknowledging the history of our world, not just our country or our city or our state, our world. We led this compassion fatigue webinar at the third Thursday in August with Laura Mendoza, who is our program manager. That's on our website. You see that link at the bottom. So I just put that here for a reference, for a reminder. It'll go deeper into what we just talked about in terms of compassion fatigue and burnout. Here's another source we had at the end of August about suicide prevention. You can go to that link here. All these will be available after, but I just wanted to point out when talking about suicide or self-harm, it's important to look for signs, empathize and listen, ask directly, reduce the dangers, and of course, understand next steps. Listed here are something for teens on the left and something for adults on the right. Both are important factors, whether you're working with youth or working with your staff that does work with youth. We're all experiencing this right now. I was talking to a mentoring organization last week, and he said, my staff is really feeling some kind of way, and I'm scared. So this was a resource that I shared with that organization. So I'm sharing with you. Once again, all this will be available after this call. Lastly, some tiny survival guide tips. Protect your mornings. I recently bought an exercise bike, and now my mornings are protected. My quote unquote commute to work is my 10-mile drive on my exercise bike. Yet I still go outside into my yard, breathe in fresh air, and go right back to my computer. It's important to be active, whatever that means to you. Engage in relationships, whether virtual or in person. Be appreciative, detox, as I stated earlier. We've all been, many of us who do imbibe, have been maybe imbibing more, spending time with animals. We bought a dog. That's been relatively helpful. and been great. And then the list goes on. You can read, but I'm a big fan of laughter. Talking to Laura yesterday, and she says, "Can we laugh more?" And I said, "Yes, let's do that." So let's jump into some attendance resources. These are from Mentor National. And if we're working with schools or school districts, here's some things you can mention to them around the social emotional aspects of mentoring to increase attendance, to increase belonging, to increase sense of wellness in young people. There's also this organization called attendancework.org. They're a national organization. They work on chronic absence, ways to address chronic absence. They have research and evidence-based solutions and positive engagement, actionable data, building capacity, and more. They're listed on our website. You can go to attendancework.org or go to our website for resources and find more information around that. Tom, always if you want to share, step in, because I know you work with Attendance Works quite closely. If you want to add anything.
I just did, James. I put in the
perfect.
box, OSPI, Office of Superintendent of Public Instructions,
Yep.
as a great resource, and they work with Attendance Work very closely as we do. And there are posters in there. There are radio spots. There's a whole toolkit on this attendance and what they're trying to do and all that. It's in your chat box.
Thank you, Tom. Starting Monday, we have this campaign about working with educational systems, focusing on equity, on connecting, and reflecting. These resources will be freely available to you to reach out to schools, school districts if you have not. I know depending on where you are, what part of the state, some schools are allowing external providers into the building to work with the students on site. Others are not. So this is really dependent upon where you are and what part of the state you're in, or even not even what part of the state, what school district you're working in, and even which county or region you're in. But what's most important to increase attendance is, does every student have access to a caring adult, right? Washington State ranks sixth in terms of internet access. So of all the 50 states, we're number 6. Yet still half of our student population in rural parts of the state never logged in since March of 2020. That's 50%. That's a lot of young people in rural Washington that have never touched school in almost 3 years, or 2 years, I should say. There's some other resources that we've been posting on social media, and this is what Tyler Lockett. This is a great one to use because as Tom told me Sunday, I'm not an American football fan, except the Chicago Bears. Tyler Lockett scored 2 touchdowns this past Sunday. So we want to highlight a Seahawk and get some love to our local youth. And here's some of the stuff that I got from the OSP website that Tom mentioned. Attendance incentives. Outreach to family really impacts school-wide culture of attendance. They don't need to be costly. I think it's really important to ask students what they consider a meaningful incentive. Sometimes it's not just financial. Sometimes it's time. Sometimes it's a caring ear. Sometimes it's tickets to a museum. Speaking of that, if you are in the Seattle area and want to attend MOPOP for free, you are, as a community partner of Mentor Washington's, you are welcome to take youth to that MOPOP, Museum of Pop Culture in the Seattle Center, for free. All you have to do is say, hey, I'm with Mentor Washington, and you and the young people that you work with will have free access to the facility. If you have a party of more than 10 that want to attend Museum of Pop Culture, please let us know, and we will book that with MOPOP.
Hey, James, can I jump in here for a second?
Please do, yeah.
And I just want to add to the folks on there that attendance is not a blame game. When you think about it, I mean, kids, they can't drive themselves to school, most kids, the younger ones. And so it really is, if they're not in their seats, and it's 2 days a month, times 9, 18 days a year makes you chronically absent. And being chronically absent puts you on pathways to dropping out of school to prison pipeline. And again, this is not a blame game. We need to get those students in their shares. Now, there is a missing group of kids last year, and you guys all work with young folks right there that are missing, and no one knows where they are. And so whether the parents did not enroll them, most of them, a lot of them are younger age, that they're not going to get there when they return to school. And we know that puts additional pressure on the teacher, because if you have kids that are missing and now they're there, you got to catch them up. James started off with the test stuff. So how do you get kids caught up while still maintaining your classroom? So it really is disruptive to everything right here. And at the end of the day, instead of just passing the kids along, so this attendance stuff, it has a lot of ramifications, and it starts off really early. If you don't get on track and you don't stay consistent, a lot of those behaviors will enter into adulthood. I don't have to miss a day here. I got here. Next thing you're missing work. And the research shows this, that behaviors and patterns that make a difference and stuff. And so there is a big push in our state a couple of years ago, well, about 5 years ago, when they started tracking it. Washington State had the worst attendance in the nation. And the alarms went off. Now, we do keep the best tracking, one of the best. So it did show the worst. And so they're trying to combat, going up a couple of years ago, they went to number 2, but I still think we're in the top 5. And again, there's lots of reasons, you're a migrant community here, you're going out, you're farming or you're transitional. There's things that back in the day, if you in our state, if you were a hunter, you'd miss things because it's hunting season. I'm gonna take off the week. That still puts the classroom behind. Some parents, if you're fluent, you know what, we're gonna do a family vacation. It's cheaper to go this week. So we're gonna start spring break early. And then we're gonna get the extra week. It still puts the class behind when those kids come back. I've been guilty of that myself, let's just get a cheaper flight and go down. Still puts them behind and puts additional pressures on those teachers when they come back. So definitely take a look at this attendance stuff. We have a lot of good stuff in there. And OSPI, like I said, has a whole suite of things right here that we can be sharing with folks, with parents, with caretakers, and with community members on that. Thanks, James.
Thank you, Tom. I would like to add to that. I was talking to that. There's been no real planning for the possibility of virtual learning systemically as a state. We all thought by this time this year, we would not have to worry about COVID as much as we do now. In Seattle Public Schools, I was talking to a colleague of mine, and his daughter, she is 13, so she was vaccinated, but her 2 siblings have sickle cell anemia. So she is scared to go to school because she doesn't bring back any illness to her siblings. Now, the school district doesn't have the capacity for virtual learning for this young person. Now, she's one of many young people that's trying to learn virtually, but cannot because of health restrictions, immunocompromised family members. So my suggestion is reaching out to the schools and saying, is there a young person that you're missing? How do we connect with this person? As a mentoring organization, you could be that link between absence and success. So that's just something to share. Yeah, I agree, Jim. I think people are hoping if we don't plan for it, it won't happen. That's unfortunately it's not the case. I work with a lot of classroom teachers, and they're at their wits' end, not because of the students, but because of the lack of consistency, which we talked about earlier. The lack of consistency applies to young people and to adults as well. That said, there's state funding. There's state funding to support many of the work that's happening. From Office of Supervision and Public Instruction, there will be more grant information coming soon, actually next month, around what's available for academic, behavioral health, wraparound, and mentoring. That's all the work that we do. Right now, the after-school grants provided by the 21st Century Community Learning Centers are granted to organizations that have already been granted. Leftover funds will be granted through a process not yet determined. OSPI, as many organizations, state agencies, are going through a lot of changes right now. So when that information becomes readily available, we will share it through our newsletter on our website. But you can always go to this link to find more info for yourself. The same for the Healthcare Authority, HCA. These are the 3 funding categories that they prioritize in terms of working with young people: opioids, marijuana account, and the Mental Health Promotion Project. And I want to mention the Mental Health Promotion Project because that's evidence-based mentoring for school-based mentoring. It's evidence-based resources for school-based mentoring. So if you work in schools around mental health, there's evidence-based practices to supplement or support the work that you are doing inside the schools, and there's funding addressed to it. There's no funding coming out right now for that, but there will be funding coming out more. We have a meeting with HCA on Monday. So as I said, the more we know, the more we will share. And if you want to learn more about the funding mechanisms at the Healthcare Authority, you can go to the athenaforum.org/CBO, community-based organization. So vaccines, woo, let's get into it. Here's a little video that I thought was pretty interesting just about the vaccines. You know, Vic and I were just having a chat earlier. People that don't want to get a vaccine or scared or hesitant, I'm hoping this can clear up some of the information, and I will share this. I'll play this video for a bit. Whoops.
In the 20th century, most vaccines took well over a decade to research, test, and produce. But the vaccines for COVID-19 cleared the threshold for emergency use in less than 11 months. The secret behind this speed is a medical technology that's been developing for decades, the mRNA vaccine. This new treatment uses our body's existing cellular machinery to trigger an immune response, protecting us from viruses without ever experiencing an infection. And in the future, this approach might be able to treat new diseases almost as quickly as they emerge.
With many communities, and I will point to my own communities of color, there's reasons why we're not getting vaccinated. You know, I was talking to my cousin. I'm not doing it. This is brand new. Who knows what's going to work? And I said, it's been around. This research has been going on for a while. That eased their minds. They're still not vaccinated, but now they're thinking about it more. So what can we do as individuals working in communities, in organizations, to increase more people getting vaccines? The evidence, the science is behind it. The only way out of COVID is through vaccination. It's impossible for anyone under 12 to be vaccinated. My kids turned 12 Tuesday. They got vaccinated on Tuesday. They were so excited and also so mad that I took them out of school to get vaccinated, but that's another point. They are vaccinated, and that's the only way to get rid of COVID, or to move past COVID, from pandemic to just endemic. That said, there are many people that are immunocompromised or religious reasons that cannot be vaccinated, and we'll talk about that a little bit later. This is just a little image I saw on the CDC website about how vaccines spread so quickly. So this is using anti-transmission prevention measures, such as wearing a mask, getting vaccination. The impact, the initial infection goes from one person to another, considering if everyone else has a vaccine and is wearing a mask. If those two aren't in place, the possibility of spread is that much more. And Vic, you were saying something, reminded you of another image you saw. What was that image?
I don't know if it's appropriate for me to draw the comparison.
Oh, to STDs.
There you go.
Yes, right. Yeah,
Yes.
that's right. Thank you. So let's get into this. The vaccine proclamation for working with children and youth. We are the final two bullet points. So anyone in the youth development program providing childcare, other supports to school-age children, including supports to assist in K-12 instruction, must be vaccinated. That includes contractors and early learning and childcare coaches, consultants, volunteers, read mentors, trainers, etc. I just wanted to make sure that was clear for everyone right now. The order also says that any state agency you must be vaccinated by October 18th. And that's anyone working for the state or working in an educational setting. Sunday, September 12th, if you have not been vaccinated by Sunday, September 12th, you may not meet this deadline of October 18th. So let's talk about what that means for you, your staff, and your mentors or mentoring organizations. The disability and religious accommodations are such that we require to obtain self-attestation or proof of vaccine from mentors. Here's what I suggest you do, and Tom, jump in when you want. You just have to show your vaccine card. Schools will start asking for proof of vaccination, as will other organizations, especially working with state entities. So the answer is yes. Your vaccine card will be the proof. It's not on any medical record, unfortunately. Tom was just talking about that. You have to keep your paper card that is very flimsy, safe, and readily accessible. I suggest taking a photo of your card on your phone and keeping it there, as well as putting it and laminating it like Tom did. Those are great reasons. So if you do not get vaccinated because of religious reasons or disability, you do need proof of that. And for religious reasons, you have to prove, I've dug through this, that you've never been vaccinated. So it can't be like, well, this goes against my religious beliefs now, but there's evidence that you've been vaccinated beforehand and with measles, mumps, or anything else. That is not an appropriate, from the state standpoint, accommodation for religious right to be unvaccinated. So I just want to put that out there. If you have staff or yourself or people that you're working with, they're like, this goes against my religion, there needs to be verifiable proof of a lifelong accommodation around vaccines. Any questions around that? I'll stop there. I've just delivered an onslaught of information. So I want to stop there and pause to see if there's any questions. Opening the chat. Sense of a holding pattern as we are in a local school district. Wait to see who does not get vaxxed and the total staff's impact. We're not going to move forward with volunteers in our schools until we get staffing matters settled. Great, thank you, Jim. Yeah, I think you are like many organizations on pause. Like, we'll see what's happening. There's no plans from OSPI or any of the school districts to go into full remote or full virtual. That's not an option right now. My guess, this is just my personal hypothesis, is that it will be inevitable in the coming months, especially as it gets colder and more people start moving indoors versus outdoors. Some schools are having lunch outside, which I think is a great idea. Other schools are not, depending on the location or the weather. So my prediction is that it'll be we won't know what to do until we know what to do. So thank you for that, Jim.
James, can I ask you a question?
Please.
This is Susanna.
Hey, Susanna.
Hey, so I do believe all of our mentors are vaccinated.
Mm-hmm.
But should I find that one is not, then should I put their mentoring relationship on hold?
Yes, I would suggest yes, to be safe.
Okay.
Are they working in a school setting?
No, we're community-based, and right
Yeah.
now everyone's meeting outside and fully masked because we're a universal masking county, regardless of
Right.
vaccination status.
Right.
And in the beginning of the pandemic, we had 99% reports on vaccination, but we've recruited a few new mentors and are recruiting now. So I think we should alter our publications to say vaccines, proof of vaccination status, in order to be a mentor with our program.
Yeah, I would lean that way as well. And also, if someone's unvaccinated, there needs to be some conversation with the families. Like, hey, do you mind working with a person that is not vaccinated? Many families, you've probably done that. Yeah.
Well, we've definitely had the
would,
inverse. We've had the inverse conversation because there's so many family members who are ineligible for vaccines right now.
Yes, right. Yeah. I would definitely lean on that.
From a state standpoint, James, we are dealing with, like most organizations or larger organizations, dealing with the staff first, and then it's going to roll out to the contractors. You saw the stuff from the governor's office. For the mentoring stuff, I think that will all play out in the next several weeks. Some of those mentoring relationships will go virtual again. And so that plays a different role. When we're talked about folks that are our mentoring relationships that come into our institutions, they will have to be vaccinated to come into our institutions. But there really isn't, set, and again, part of this is they're developing as they go, is these set guidelines. If like what Susanna's talking about, hey, if you didn't, you can't mentor. Then for some of us right here, for special populations and stuff, and we'll lose staff, you'll lose mentors. what's that means. But I think that's gonna play out in the next couple of weeks. You know, what's mandatory, so we don't have to guess. You know, I got 19 of my people are vaccinated, and this one person is. I'm just going to drop them. You'll actually have something that says that, whether it's from the state or from the governor's office or, you know, from your employer, that says that makes it more, you know, it's a mandatory, you know, I don't think it's mandatory yet.
Right.
Yeah.
Yeah.
The timeline, the dates haven't came here yet. You know,
Right.
those two dates haven't existed yet.
Yeah.
You know, people still can get the Johnson & Johnson shot. There are in our case, there are a couple lawsuits pending, you know, with troopers and law enforcement, and they need to figure that stuff out, you know, before that. But I do think it is headed that direction.
Yeah, I do too. October 19th will prove a very informative day. I know some schools in King County have already asked, you know, teaching artists or external staff, can you show me proof of vaccination before you even enter the building, even though by law it's not required until October 18th. So, I mean, that was an inappropriate request from that school, but it's going to happen. More and more schools will say, you can't come into the building, more and more facilities, you can't come to the building, more and more state entities, you cannot work with this population unless you have proof. So yeah, just buttressing what you said, Tom. Thank you.
Yeah, and I think the other part is where we're located in the parts of the state. I mean,
Yes.
we're in pretty, you know, a part that embraces that. You go not too far off the freeway, and there's different views from schools and from their mayors and city council, and so that would be interesting in different areas where that plays out, what they enforce and what they don't. And I mean, they're talking at OSPI about holding funds back. Holding their school funds back if they don't do that, and they have a list that they will not. But who really loses in the end of that? You know, you hold the funds back, kids can't learn. So it's a chess game.
Definitely. Yeah, I was reading in rural Oregon that some firefighters, volunteer and professional police officers, and other employees of regional localities aren't going to get vaccinated. And they will decimate, especially as fires are still raging in parts of the West Coast, they'll decimate the workforce. So this is the time for, you know, like I mentioned, collaboration and peer support. This is the time we will lean into that need to work with each other and support each other to make a better, not better, but a more functioning society where we can work with these youth.
And you talked about stressors. I wanted to share a quick story of a guy that I work out with on the weekends and stuff. Him and his wife are vaccinated. They're elderly, but their kids are not. And the kids are now, the one person was a nurse. The kid's mom was a nurse, and she's refusing to, and it's her right, she's refusing to get vaccinated. Well, she's going to lose her job. And so now she's telling the kids, well, we're going to be out on the streets because I'm going to lose my job. So the kid was crying to his grandmother. So when you talk about stressors, you know, from a parent not getting, you know, this is as basic as not getting vaccinated, and they put the stress on the kids. We're not going to eat. I don't know what we're going to do for a job because I'm not getting the shot. And it rolled down, and now the kid has this pressure, this angst that I'm going to be homeless, and we're going to live on the streets and all that. And a kid shouldn't have to experience that. I mean, it's wrong for the parents to do that, but it's real. And so they're not the only ones around that. I mean, so it does, you know, people's actions do relay on the youth, on their kids.
Yeah. Yeah, that's some deep stuff. I wanted to show this COVID dashboard from the Department of Health. And this is data as of September 13th. 75% of Washington's been 12 and up has one dose, and 68% are fully vaccinated. You know, the population of Washington State is, in terms of youth under 12, is I want to say is 200,000. I think that's the number. So, it's right here. You see, yeah, several 100,000 are not vaccinated. So that 70% and 68% go down when accounting for those under the age of 12. Also, here's a map located on the dashboard. You can see, though King County has the highest rate of vaccination, it also has the highest rate of confirmed cases of COVID. So this is just to illuminate where COVID is really hitting hard. King County is one, Spokane, all these gray areas. But when you get to more rural parts of the state, you have less and less instances of confirmed cases of COVID. This is a good resource for just seeing where you are and you're part of the state to help navigate those conversations that Tom was talking about. No one wants to lose a nurse or a teacher or a fire department or a police officer because of lack of vaccination. We want to ensure a healthy society. So how do we work together? How do we support one another? Here's some key considerations from the DOH to reduce exposure in schools, but not limited to. Promoting vaccination, what does that look like? Well, there are some public resources to share. You know, I know what's happening in other parts of this in the country. You know, it really takes the community member to get into that community and say, like, here's what we need to do to get past or through COVID, especially in those communities that are furthest from opportunity. And that could be any demographic, racial demographic, but it doesn't take, it does take community investment and conversation to mitigate the COVID-19 transmission and I would say in and out of schools. But physical distancing, vaccination, mask covering, staying home when sick. My kids we've gotten 3 emails since school started about a positive case in their class. You know, they've been in school for 11 days. Yet, there's not once been like, you should stay home. So consistent messaging will also be key because what happens in school translates to what's happening, you know, as Susanna said, when you're meeting off-site. This young person has a COVID case in school and is meeting with their mentor who may or may not be vaccinated. You're increasing the probability of spreading COVID to other families. Here's some back-to-school resources. You know, for program resources, go here. There's focus on insights and innovations from a national standpoint on mentoring and some no-cost consultation. We know that, and the consultation is through the National Mentoring Resource Center. We know that many organizations, many places are gonna go through some tough times. I won't say tougher, but it could be equally as tough, if not tougher, than when we projected to March 2020 of last year. And capacity building and training could be of some benefit, and the fact that it's free could really be a resource for all of you. So I went through a lot of information very quickly. So I'm gonna open it up to questions and conversation. I really wanna check in and see how everyone's doing with all these COVID resources. And yeah, thank you, Vic, free to unmute. Any questions you have, you know, Tom's working at DCOF, so he's representing the state. As he said, we work with many of the state departments and we can help connect resources or ideas or policies to you if needed. So questions open up right now. What are you seeing? What are you feeling? What are you thinking? Oh, thanks. Thanks, Tom, for putting that funding opportunity in.
This is Susanna, and
Yes.
I'm relieved when we get a mandate from either you or the state, because when we're left to interpret any sort of protocols, then it becomes more of a discussion. But when it's a mandate, it becomes a matter of just program compliance. So it's just a lot easier for us to communicate it.
Great. Thank you for that.
Yeah, it was tricky for us. So we're in 2 school districts, and one of our school districts has some leadership change. And so the schools kind of interpreted what they felt the rules were right now. So they let mentors start in person. Then the district heard that they were, and they said, no, the numbers are going up. So they've now stopped us, the mentors, from meeting in person and want us all virtual for now. So that was a little bit, you know, a little disheartening.
Right.
And the other school district's still moving forward, but they're saying, no, nobody can come until October 18th. So.
Oh, okay. Well, I guess there's a date. That's at least something to look forward to, right? Yeah.
Yeah.
Yeah. The inconsistency in school districts in terms of what can and what cannot happen. If any message was for OSPI or for the ESDs, it would be that, whether you're large, whether you're small, urban, rural, please have some egalitarian and utilitarian messaging. It's basically, if you talk about tier 1 support systems, it's that tier 1 messaging. Here's what's happening, right? Wear a mask, get vaccinated, 6 feet apart, be cautious, small groups. That tier 2 messaging is small, like, here's your school district. Your school district should be doing this. And then the tier 1 messaging is like, here's what's happening in your classroom with this one student, or your youth center with this one person. Here's the messaging you need. If they're immunocompromised, if they're under the age of 12, how do you work? That's what we need as a state. Some kind of messaging that's utilitarian, that could be applicable to everyone, no matter what you're doing. So thank you for saying that, Heather. Oh, thanks, Vic. Yeah. Any other concerns, questions, thoughts that we can take to the governor's office, to OSPI, to DCYF, to HCA, Department of Health?
I know another thing, sorry to go again, but
Please.
Some of it is confusing, the common theme. They have the rules, masks, be separated, but even from the kids and staff, they're not really enforcing it in school. So it's really confusing, the message that is coming across. Like, are we supposed to be masked and stay away, or are we not? So,
Right.
So it makes it so uncertain and more stressful not knowing.
Agreed. Yeah. I was talking to someone in Pierce County, and she said that when her son went to school, his teacher said, oh, just cover your mouth. You don't need to cover your nose while you're in school. You're fine, which is incredibly inconsistent with the messaging around mask wearing, right? And if that's happening in one school, in one classroom in Pierce County, you can guarantee it's happening in other parts of the state. So I'm always thinking from our lens as Mentor Washington, how we can support those efforts, right? So what you just stated, Heather, is important. Like, we can talk about this. Here's what's happening in Snohomish. Here's what's happening in Pierce County. Here's what's happening in King County. How do we brainstorm through this together? Yeah.
And I was also wondering, could mentoring take place? One of our schools, our high school, said they have outdoor tents. They don't want mentors coming in the building right now, but could schools that say no, they can't come in, we put up tents? I realize it would be cold, but it's better to be cold for like a half hour than not meet.
That's a great idea. I know that there's a school here in Seattle where they did put up tents. It's for school lunches, but why not utilize those for mentoring? Or at your site, putting up a tent. I think that's a great idea to mitigate, like, all right, we don't want to be virtual, but we can't be in person. How about we meet outside, 6 feet apart, wearing masks, and have this conversation, right? I think or have this mentoring session. I think it's that's good. And this is the kind of stuff we can take back to say, like, here's what we're seeing across the state. We need to find ways to bring some resources to different communities to just purchase a tent for 20 feet by 20 feet tent for people to sit under. I think that's great. Tom, what are you thinking?
I'm just curious to others on the phone. I know this is I mean, we don't have answers for a lot of this stuff. Right. It's not we collectively, and I'm thinking about, I just heard yesterday, there's a couple schools in Federal Way that sent their students home because they don't have teachers. Teachers had COVID, so there's no one to teach the class. And I heard another incident where the kid, there was a teacher that was COVID positive, so that everyone has to be in quarantine. There's just another disruption, and there's no end in sight, so we have to make these, fixes, the virtual stuff. And as Heather was talking about the virtual tents, I was thinking about all the restaurants and bars that were doing that. But you get to come in and take your mask off in there and eat and talk. And, I went to a Seahawk game a couple of weeks ago, and you have to wear your mask to come in, but once you were in, it was a free for all. So nothing was really enforced. So, I mean, we're not consistent on our messaging. But for the folks on the phone today, I mean, part of this is the share, but a part of it also, to which you call it, what is happening in your communities, and how are you dealing with this in your organization? How are you dealing with this as a person? And then as an organization, what are some of the, gaps? What are some of the successes, that we can share around around the group?
We made a map of all the outdoor pavilions on the island, including private barns that will open all their doors. We found like 37 sites on our island.
That's amazing.
And we shared them with ours. We've also developed sign-up sheets for outdoor pavilion spaces where people want to meet one-on-one, and they still have to be fully masked and no eating or drinking. We also partner with the Tourism Bureau here to find out which public events are outdoors and occurring so that we can advertise them as like small groups to go together. If a couple of mentors and mentees want to go on the farm tour on orchids or the apple pressing party, as long as everyone's in compliance, they get in an hour ahead of everyone else.
I love that.
Always good stuff happening up your way. It's really
Thank
great
you,
ideas.
Susanna. That's great. To speak to teacher shortage, I know communities and schools, they do wraparound services. There's been recently, I think it was the Renton community schools, the mentors were tasked to do other assignments in the building because there were no teachers there, including monitoring the lunchroom. Because the teacher's out, so we have no one to do this. You have to do this. Is anyone else experiencing your mentors having to do work outside of what they're actually tasked to do, whether it's monitoring lunchroom, teach a class, or babysit, childcare? Just wondering.
Well, first of all, can you hear me?
Yes, thank you, David.
Perfect. Yeah. This is an observation that's kind of related to that. I've been talking to, well, first of all, I'm a program coordinator from Big Brother Big Sisters. We're based in Seattle for King County families.
Yep.
And there's one of the biggest things I'm starting to notice with a lot of my cases is parents are having to stay home because if there's even like one kid that gets COVID, the whole class has to quarantine for 14 days. So what ends up happening is the parent, sometimes a family in need, who's just living by paycheck, they're having to stay at home and homeschool the kiddo and try to work from home if they're even lucky enough to have that opportunity. It's just these parents are just going through everything and having to be also a teacher as well. It's a lot going on for them.
Yeah. Yeah, it's definitely a lot. Yeah, and as Tom said, I don't know if there's an answer to that, right? How do we, because that requires other systems. That requires universal income. If this has to happen, how are you going to support yourself and your family if you work at Target or you work at the grocery store and you have to show up in person to work, right, and take care of your kid? What systems need to be created to do that? Yeah, I know my friend has a 8-year-old, 6-year-old, and a 5-month-old. And in the 8-year-old's class, there was a COVID case. So all 3 kids had to stay home. And then because, she has a live-in nanny, or not live-in, a nanny that comes in 3 times a week, the nanny couldn't come in. So she had to take care of the kids and work full-time. She's the vice president of an organization. And so she was at her wit's end and called me. What do I do? I was like, take a day off of work. I'm sorry. And I will help whatever I can. But it's tough. Thank you, David, for mentioning that. Any other concerns, thoughts, queries? Related, we have several trainings coming up in the coming weeks and months around mentoring, outreach, paddock practices, fundraising, grant making, those are on our website. Can you put that link in the chat, Vic? For, this isn't addressing COVID, but it will help navigate some of the issues that we may be facing as mentoring providers.
One of the ones that are new for us, and I've been with Mentor Washington for a while, is this concept of mentor training for mentors.
Yes.
So there's going to be a series on that. And some of it probably will include COVID, since and we'll adjust and make, because that's just part of the trainings these days and stuff. So if folks are interested in that, and it's at an hour that mentors can attend. And Laura's putting those on, James?
Yes.
So and if there's specific things that need to address, please reach out to Laura Mendoza, with that right here. If you're thinking something, after the thing, because we want to build those and include stuff right here from those. She does have a provider network that she's putting the trainings together with, but there's always room for improvement. So if you see something, or if we're not touching something, please let us know and stuff, and we'll definitely add that, to the mix.
Yeah, I think creative approach to mentoring will just continue to be needed right now. How do we continue the work we're doing, supporting youth and youth development programs through training? Because it will require us to think outside the box, for sure.
And the other things that, you'll see these on our website and see these during this call is, we have a strong relationship with DCYF, also with OSPI and Healthcare Authority. And then those three, we're addressing foster youth, kids in the juvenile justice system. You got kids in the verge of dropout, academic failure. You got kids with chemical and substance abuse, issues, and we're trying to prevent those, mental health. And so there are all those agencies have resources for those young folks. And I know that you guys have those young folks in the midst. And so with some of those folks comes additional resources. For example, foster care, where there's some additional funds for them. There's a lot of stuff for foster youth right here. Not enough, but there's plenty of stuff out there. And we want to make sure that you know about that in your organizations. As that, like I dropped in the chat box earlier, there's a funding opportunity for vulnerable youth from Commerce. And that's some of the leftover state dollars, or federal dollars, not state dollars, the CARE dollars. There's quite a bit of CARE dollars still left. And so that's what that Commerce money is about. OSPI has the same, DCYF has the same and stuff. So definitely check back from time to time on our website. We will post those. And if you need additional information, let us know, pick up the phone and stuff, and we'll get you connected with the resource.
We met with Peggy Carlson from OSPI.
Yeah, I work with Peggy.
Yeah, because she was interested in our work, and she was talking about the new law. So she's actually coming to our next peer forum. I think I invited Vic and maybe Laura. It's October 14th.
Awesome.
And she's just going to let the school-based mentoring programs know what the new law is, that every school needs a contact for kids that are in foster care, and that it would be a good idea for them to request to get a mentor, as well as and also homelessness. So
right.
Awesome.
She's going to share that with us.
Fantastic.
And I like, James, how you said we have to think outside the box. I already thought I was. I guess I need to think box.
no, I mean, we all are. Now it's just we have to live outside the box too.
Literally.
Yeah.
Really quickly, I just want to say thank you. I feel like what we really need right now is like this vein of consistency. And even for myself, when everything started to play out, I was very unsure of everything around the vaccine and COVID. And James and Laura and Tom, all like served as that vein of consistency for me to, do more research and understand for myself. And I think that, by coming together, we can create that vein of consistency for our youth to just be that, that influence for them. So yeah, I know that it's crazy and it's uncertain, but I see this meeting and us getting together as a way to develop that consistency as we wait for the world to tell us what's up and what's down. So thank you all for being here.
Yes, thank you all. Well, thanks everyone for joining us. As stated, this will be up on our website shortly. We will send out the resources for attendance and other school resources on Monday from Mentor National and from our marketing team when that embargo is released. You are the first people to see some of those visual aids. More will be coming, along with some language to go around that. So thanks again, and see you on the third Thursday in October, which will be October 17th. Is that right, Vic? I don't know. I didn't even know what day it is today. Something of that nature. But we'll look for an email and social media post.
21st.
21st. Thank you. Appreciate it.
Thank you.
Have a good one. Thanks all. Bye.
Bye.